about electronic cigarettes, or e-cigarettes. When e-cigarettes were first introduced, they were advertised as a safer alternative for regular cigarettes. But it was important to me because I have several family members who are long-term and heavy smokers. So any alternative seemed like better than smoking regular cigarettes. But then I noticed that a lot of my friends started to use e-cigarettes regularly, which really bothered me because they weren't conventional smokers and they were using them indoors. When they used them indoors, I realized that I was inhaling everything that they were exhaling, and I didn't know what was in it, and I didn't know how it would affect me or my friends. So I decided to research e-cigarettes, and I hope by the end of my presentation that you have learned about what e-cigarettes are, the dangers of using e-cigarettes, and the lack of consequences, or the consequences of not regulating e-cigarettes. Before I can convince you that unregulated sales and use of e-cigarettes is a growing problem, I would like to explain what e-cigarettes are. According to the June 2009 issue of Consumer Health Information, the FDA, or the Food and Drug Administration, states that e-cigarettes are devices designed to mimic regular cigarettes but are battery operated and are sold online or in specialty stores. Additionally, according to the Americans for Non-Smokers' Rights, e-cigarettes are also considered to be personal vaporizers, which contain a heating element that vaporizes a liquid in a cartridge. The liquid in the cartridge is composed of different flavorings like mango and apple, in addition to varying amounts of nicotine, which is a highly addictive neurotoxin. Once the solution is vaporized, a vapor is produced, which is then inhaled, and then the nicotine in the vapor is then distributed throughout the body. Currently, there are no federal regulations regarding the sales of e-cigarettes and its uses, especially including devices and the liquids. This means that there is no legal age limit for which these can be purchased, allowing products to be sold online and made available to the general population, including minors. Now that we understand how e-cigarettes work and what they are, I would like to address the dangers of using e-cigarettes. According to an article in the New York Times by Matt Richel, toxicologists warn that e-cigarette liquids are a significant risk to the public, especially children who are drawn to the different flavorings and the bold colors of the e-liquids. This is because e-liquids containing nicotine are highly potent and are absorbed much faster into the body compared to regular tobacco products. They are so powerful that a small child ingesting only a tablespoon or a teaspoon of the solution can be killed. The use of e-cigarettes is on the rise, and in 2013, 1,351 cases regarding e-cigarettes and its liquid solutions have been reported, which is a 300% increase from the cases reported in 2012. Other dangers were featured in a study by the FDA involving the Division of Pharmaceutical Analysis. The study found that some products contained detectable amounts of cancer-causing agents or carcinogens and other chemical toxins that can be exposed to the users and the people surrounding the users in its vapor or liquid form. Aside from nicotine, the toxins that can be found in some of these products include nitrosamine, which is a carcinogen, diethylene glycol, which is a toxic ingredient found in antifreeze, and there are other tobacco-specific impurities. However, the more disconcerting fact is based on a study by Jan Sogala in a research journal, which states that there have been little to no long-term studies in the overall regarding the overall health risks of e-cigarette use and of the secondhand vapor of surrounding people. This brings me to my last point on the consequences of unregulated sales and use. According to a study by Monique Williams found from the University of California, because e-cigarettes aren't federally regulated, the products are significantly different from one another, and this variability makes it very difficult for researchers to conduct studies comparing the products in addition to long-term studies regarding the health risks. Another consequence is that the products may be inconsistent and misleading, as described in another FDA study. In the study, some of the liquids low yet detectable levels of nicotine in them. Additionally, cartridges that contain the same materials and the same liquids dispense different levels of nicotine, some of which were higher than they should have been and some of which were lower than they should have been, preventing the user from controlling how much nicotine they were actually using. The cigarette industry is growing and becoming increasingly popular, creating a subculture in itself. At the same time, there's a lack of regulation and consistency preventing researchers from conducting studies that provide accurate information necessary to inform the public. After explaining what e-cigarettes are, the dangers of using them, and the consequences that result from unregulated sales and uses, I hope that everyone is better educated and concerned about this growing issue.